All right. Good afternoon.
Good afternoon.
And please identify yourself.
I'm Dr. James Kevin Brannon, orthopedic surgeon in Leawood, Kansas.
And you also were on the faculty of the medical school here.
At UMKC School of Medicine, Department of Orthopedic Surgery.
I see. And please tell me your story.
Well, I think my story can be characterized by just a few words: a lot of head and neck pain, and an unstable bite that had turned out to be terribly frustrating for me. And I believed it was preventing me from being able to complete my surgical procedures without being worried about my neck or my back or things of that sort. So I sought intervention. And I had actually traveled to California, thinking perhaps there were dentists there, since I'd heard about a lot of the cosmetic work that was being done in California and ability to restore the bite. But I thought I'd just do a little bit more in-depth research and found you, Dr. Rahman, here in the Kansas area, which made it a lot easier for me to get the care I believe I needed.
Prior to growing up, you had orthodontics too.
That is true. I
And
wore
how many
braces as a child at least 3 or 4 times that I can recall.
And reason it was repeated is because?
Well, because the then current orthodontist believed that I could correct my bite simply by wearing more braces.
Okay. So this was an issue even as a young man?
Recently, as an adult.
Okay.
Yes,
Okay.
recently, as an adult. And actually, that occurred before I moved to Kansas, which was, I believe, in 2003 to 2004.
Okay.
Early 2005.
Okay. But you had braces growing up, and then
Oh,
as
indeed.
as an adult as well.
As an adult as well.
Okay. All right. Now, if we can fast forward briefly, what did you find about what we do that made sense to you as a scientist? I know you're an inventor as well. What made sense to you?
Well, first of all, I think what made most sense to me is the ability of the team that provided the care to listen to what my complaints were. And after listening to me, then taking a series of photographs and x-rays, and then sitting down with me and explaining the current clinical circumstances. That probably is what impressed me the most.
Besides impression, which is good, but you also were curious, are interested in knowing the measurement of the EMGs and how that showed us where you need to be, if I can remember correctly. I know it's been a couple of years.
Yes, it has been a while. I think, as an orthopedic surgeon, I understand the importance of length and alignment and the stability of the joints. And really, after meeting with you, what became grossly apparent to me is that my articulation between my upper and lower teeth, it was poor. And over the years, that had led to subluxation of my TMJ. That led to the chronic headaches and neck pain that I was experiencing. And I believe that because my bite was off, and the nature of my work, where I'm performing surgery, toe, hips, knees, etc., I'm constantly with my head, neck in a flex position that further brought my mandible posterior and subluxed my TMJ joint. And I believe that principally was occurring, as I've learned throughout these clinical visits, is because my bite was not stable. And that created an environment where the lower mandible was constantly looking for a stable articulation, which put the masseter muscles in spasm and a variety of the other muscles around the head-neck junction and the strap muscles, and it just chronically created this spasm and headaches that I was having, waking me up on occasion at night, or having my wife just try and stretch these muscles out. And just after simply analyzing which muscles were spasming, finding out where the poor articulation existed in bringing the upper and lower mandible together so that my jaw could stop moving. I mean, it was relief within I think it was a week's time or something like that. So it was great.
So that is where we put the orthotic on your lower teeth.
That is
which
true.
you still
That
have
is
part
correct.
of it,
And
don't
I
you?
still have that orthotic there.
And then you were obviously given an option to try that out, so to speak, reversibly, and
Correct.
you noticed improvement right away, and then you chose to
Move
make
forward.
it more
That
permanent
is
changes. Okay. And you started. What level of relief did you receive, Dr. Brannon, soon after the orthotic was put in?
Oh, it was night and day. I would say on the order of 95% or more. I mean, again, I want to make something very clear. When I started the treatment, I understood what needed to occur. And then doing similar work on the extremities, and I saw that objective be brought into full effect. It just brought immediate relief. I have not had these headaches.
It's been almost 3
I'm
years
not
now.
having
I know it's
these
your
spasms. I can wear my lead, do my surgeries. They typically may last 3 to 4 hours. They're very complex cases, and that's why I'm so bloody busy now.
right.
And I'm not stressed at the end of the case. And, often I have to share this with you, that when I would operate, just in the middle of the case, I would have to stop and arch my back completely backwards or something for at least, 3 or 4 minutes, because I just felt
Just so you can continue on.
wrenched into a position where I just was not comfortable.
That's what you used to do.
I used to do that, but again, what was happening? This mandible was unstable. It was going posterior, and it was causing this neck pain. And then the combination of me having to lean forward like this to bring the operative field into view just created an environment that was just untenable.
And what has it been since? I know it's been almost 3 years, and partly because of a very busy schedule, it's taking longer.
Right.
But
look,
how
I'm happy.
I know.
Look, that's the
part of the reason I bring that up is there are those that feel like, how long would that be stable? Is it a temporary relief? That's why I'm asking about
No, I don't believe that the relief has been temporary at all, because
Sure.
the objective has been met, which was to restore a normal articulation between the upper and lower jaw, which brings about the stability, and to reduce the TMJ.
Okay. And how would you respond to these primarily academic dentists, professors, and so on, that feel that this idea of changing the bite is totally without any relevance, or measuring the muscles, all this neuromuscular dentistry is totally without any credibility in their opinion? How would you respond to that?
Well, I respond in 2 ways.
Okay.
The first of which is going to be, I guess, a politically correct way to respond.
No, go ahead and tell me however you feel.
Which would be, a lot of us in healthcare don't like change. And if we've been doing something a certain way for a long time, it is difficult for us to believe, particularly as we reach the end of our careers, to hear that there may be a new way that is more effective. Okay, that's a politically correct way.
Okay.
Now, the
One thing to add
politically
to that-
incorrect way to say that is I like to call that the academic cartel. And it's difficult to publish in that environment because it is different. But as I tell all of my patients, and particularly some of my colleagues, because some of the work I do is different from status quo, is that
You have made some innovative ways to fix
treat hip pain.
I know. I just want
And
to bring
avoid
it
hip replacements, etc. But what I share with my colleagues is the following. We practice to help patients. And if what we're doing is improving their lives and allowing them to achieve their ADLs, and it is safe and it is effective, then it needs to be shared with the scientific community.